I'm going to share my screen and uh, and I'm going to stop the video so we can all look at the slides, not on me. It's better to just focus on the presentation. So in this class, I want to talk about reversing diabetes naturally, but this class is also going to apply to any type of chronic inflammatory disease because diabetes is chronic inflammatory disease. So whether you're struggling with arthritis or whether you're struggling with any type of inflammation in the body, joint pain, thyroid disease, it's still going to be helpful to learn this class and to watch this class. But it's specifically, we're going to share specifically research linked to diabetes, but it's still applicable to any type of chronic inflammatory disease. So most people in their mind, they think that with age, we have to get stiffer, we have to get weaker, we have to become less flexible. But it's not true. We can keep getting better, but you have to change your mindset to do that. And this is a Greek physician. His name was Kyrophilus. And when he said that when health is absent, wisdom cannot reveal itself. So this is a Greek physician who said that when health is absent, wisdom cannot reveal itself and art cannot manifest. Wealth becomes useless and intelligence can be implied. So that's a point I'm making in this whole class. So with age, we can get all of this and still have that young strength and vitality. It's how we live. So the food lifestyle makes a difference. So the food that we eat, the lifestyle that we have is going to make a difference in how we age. But also getting enough sleep, getting enough exercise, doing yoga and breathing exercises every day, it's also very important as we age. So the truth is, we don't have to get stiffer and weaker and less flexible as we age. In fact, we can get healthier as we age, but we have to do the work to achieve it, which is I'm going to share with you more in this presentation. So as a reminder, again, this presentation is going to be more focused on diabetes, but it's also applicable to any chronic inflammatory disease. So pretty much every other medical school, they taught that there isn't cure for diabetes. It's a slow downhill degeneration into an early death as much as 19 years earlier than normal. So what I'm saying, a little revolutionary, at least when I first began to study it, as well as when we first began to say it. Now more and more studies are coming out supporting it around the world, actually. So that's the point, is that you can actually cure diabetes. And I'll just say, based on our results, we've helped clients within 3 weeks improve their blood sugar levels, and 61% of people that we worked with who had diabetes were healed in 3 weeks, who are non-insulin dependent diabetes with our clients, and more got healed later when they continued implementing what we teach in the program. But we didn't track it for more than that. So, I mean, I know from personal studies for people who are insulin dependent, like we had 80% of people who came off their medication, and then more people were actually had normal blood sugar levels. The blood sugar that's less than 100, that's really considered a cure. And between the blood sugar that's between 100 and 126 is pre-diabetes, and above 126 is diabetes. And then even more surprising to me is, quite frankly, is that 20% of the type 1 diabetes also were cured. So we had clients who had type 1 diabetes as well. And we had children who came to us with type 1 diabetes. Some of them were recently diagnosed within a year, and they were able to normalize their blood sugar levels within 7 days. We had one child we worked with who got type 1 diabetes after getting sick with COVID. Somehow it was triggered for him. But he had it no more than a year, type 1 diabetes. They found it in his blood work, and within 7 days, his blood sugar normalized. So we worked with a variety of juvenile diabetes, seeing them like 10, 15 years, and we've had some clients who continued implementing a program. They still had normal levels and off the medication. So it's very exciting to consider that there is a cure for diabetes, and it's not an early death sentence. So, and part of understanding diabetes is that it's chronic inflammatory disease when the whole body is inflamed, the brain is inflamed, and there's higher rates, double the rate of Alzheimer's. So it's just general inflammation, like we teach in our classes, which also increases heart attacks and general ill health. So that's what we are talking about. So being overweight is a problem, and that's a precursor of potentially diabetes. So this is according to CDC, which represents the status quo thinking. A quarter of the people over age 60 have diabetes. So 26 million people in 2024 and 86 million people had prediabetes. So now the 600,000 is a concern because when you get like a foot ulcer, you're looking at around 80,000 people of those will require amputation of their foot or leg. And over 40% of these amputees are no longer alive after 5 years of the procedure. So we need to do everything we can to reverse chronic inflammation. Again, I'm not just speaking about diabetes, I'm speaking about chronic inflammation in general. It's an epidemiological problem as well as personal problem, and we need to have some insight into this. That's what we're doing in this lecture. We're going to talk about that. So let's redefine what we're talking about. It's not a blood sugar problem, it's a symptom of what it is. So first, it's an accelerated chronic degenerative aging process. So think about that. That's what type 2 diabetes is. And that's chronic degenerative aging process enhance inflammation. So it enhances inflammation. So it is genetic. So it's tendency that we have, but the epigenetic program, which is the part that controls the gene expression, it turns toxic and is downgraded. So the cure to diabetes is tuning the epigenetic program back to normal. That's a key. So epigenetic toxic downgrade results in leptin, which is an important hormone that tells you to stop eating burnt fat, and insulin or blood sugar, and really other hormone aspects. So basically a metabolic dysregulation of protein, lipids, fat, and carbohydrates. That's what leads to diabetes. So we're back to chronic inflammation and accelerated aging. And so basically that's a better way to understand that diabetes is a degenerative system. It's a system syndrome, and we can control it by reversing our epigenetics. So how our genes get triggered for disease. So we can change the genetics, but we can reverse it. So what causes this degenerative process? A diet high in sugar, especially processed sugar, and that's what most people think, but it's actually more than that. It's more than sugar. And that includes, so sugar includes simple and complex carbohydrates, and trans fatty acids also contribute, processed and junk foods, and animal fat and animal protein, and that includes fish as well. So why is this important? Because you'll see that some of the research is showing that animal protein and animal fat, fish fat, all degenerate the beta cells of the pancreas. And that's the name of this of the game of this disease. So actually in this study, I'm going to share with you how the animal fat, any type of animal fat or animal protein they eat, how it destroys your beta cells in the pancreas. So they all degenerate the beta cells of the pancreas. And that's also why people who eat what we teach in a program have 35 to 50% less risk of diabetes. And this is also made worse, obviously, with diet low in fiber, lifestyle stress, obesity, as well as mentioned earlier, lack of exercise. Sleep is also a big problem. So you need the research suggests that you need about 8 to 9 hours of sleep, especially women. We need more hours usually than men. We need to have more sleep, and toxic exposure like pesticides, herbicides, heavy metals, and animal fat. 95% of the pesticides and herbicides are stored in the animal fat. And this is what I talked about also in my previous classes. A lot of these pesticides are stored in the animal fat, even the organic meat. I'm going to talk more about that in the later slides. So if you're going to eat animal fat, animal tissue, you're going to get a lot of more toxic exposure. And that's even if it's organic, because the animals are still eating the grass where all the toxins fall onto. So this diet, by the nature of its like junk food and diet, is low in vitamins and minerals, antioxidants. So chronic diabetes, it's the degenerative syndrome, CDC. It is degenerative and chronic. It's associated with insulin or leptin resistance to these hormones that we're working with. And it increases with age. And really, we're looking at when people are 70 or 85 years old, almost a third of the people have that tendency of living with diabetes. And I found out that my grandfather, when he died, he died in 1993. So I don't remember how old I was. So I was little, probably like 5 years old. And my grandfather was diabetes. He had diabetes. He was around 70 years old, and he went fishing, and he got an infection in his nail, and he took the nail off, and the infection started spreading to his toe became blue, and he didn't want to see the doctor. This was 1993, and my mom told my grandfather to go see a doctor. And when he went to see a doctor, they cut off his foot, but it was too late. The infection had spread, and he got sepsis. And he asked to see us, and we said goodbye to our grandfather. I think we were 5 years old at the time. And when they cut off his leg, he died after the surgery. And that was the first time I saw my dad cry when our grandfather died. And so at that, I think he was 35 years old at the time. So he died from complication of diabetes because he got an infection. And when you get diabetes, you can't heal from infections. It spread, and it was too late. And it happened very rapidly. I think he died within 2 weeks of getting that infection. So it's very serious disease. Just all of this chronic inflammation that's the reason why we do this work, because we've seen our family suffer as well as our own health. So the toxic degenerative epigenetic like memory, so that's the name of the disease, and we have to change that, and that's what we teach you in the program. It has to be turned off to stop the cardiovascular degeneration and pro-inflammatory cytokine activation from the fat tissue. So we can change the gene expression. The genes are there, but the diet, the lifestyle that we're talking about that created diabetes, we have to reverse it. And that's what we're doing in this program. And that's why we have success, because our whole program is aimed at reversing the disease, the things that cause the disease in the first place. So the treatment of this is addressing this degenerative syndrome. It's interesting because we've been doing it for a decade, and we have some people coming to us with blood sugar over 250 that also normalizes over several months. So how do we turn off this disease? And how do we regenerate the beta cells? How do we regenerate the beta cells? So the first thing, if you're going to regenerate the beta cells, you stop eating foods that are going to destroy them. And that's what the research shows. The latest research shows is that meat, fish, and chicken actually kill your beta cells. They kill your beta cells. They kill the beta cells. And this is true for type 1 and type 2 diabetes. And with type 1, of course, there's a much higher rate of destruction. And that's why what we teach you in this program, our clients can not only reverse their diabetes, but also have significantly less beta cell degeneration and significantly less diabetes, and even risk for diabetes, people who don't even have it yet. So we have to understand that the fat tissue increases insulin resistance and intracellular and extracellular fat accumulation. So what this means is that fat, it's not just outside your body. Fat, it's also inside of your cells. And that's a whole organ. So it's a fat organ. It becomes a whole organ. It becomes a separate organ, and it releases inflammatory cytokines. So basically, it releases inflammation. And it's some technical terms here. You don't need to, understand this scientifically, but basically, fat tissues, it increases inflammation in the body. And this inflames the whole body, the whole circulatory system, and the brain. increases the risk of Alzheimer's. We talked about in the other classes. It doubles the rate of cognitive decline. So it's a very real thing, and we have to reverse it. So 88% of beta cells, even in type 1 diabetes, still produce insulin, based on the research that was done in the last 2 decades. And that's one research that I linked here if you want to read more about it, what I'm talking about here. And I'm gonna post a recording of this class in client group. So of course you're welcome to rewatch it. So what leads to diabetes? Animal fat, animal protein, all specifically attack the beta cells in the pancreas, and fish is probably the worst. I used to think that fish was the best, and my mom still eats fish, and my mom still has high cholesterol in her blood, and she had an injury in her arm, and that caused her to have higher blood pressure when she had an injury, probably some kind of physical damage. But she's no longer on any high blood pressure medications, but she still has high cholesterol in her blood work, and the mom still eats fish. But it turns out that it's the most toxic to the beta cells of the pancreas. Obesity is, as I have shown in the previous class, it creates chronic inflammation disease, and the fat, it's an inflammatory organ. So that's what we always tell our clients: the more fat you have in your body, the more toxins are stored. Toxins are actually stored in the fat cells. So oftentimes people, when they lose in 10 to 20 pounds, they lose in a lot of that inflammation, and the fat cells shrink, so you're losing toxicity and inflammation. And again, if you continue losing weight, please make sure that you check our emails with meal adjustments. You increase more higher calorie dense foods in your diet to put some of that weight back on. So soft drinks consumption is a player. Use of antibiotics, we'll cover that. We already covered that in some of our other lectures. Statin also tends to increase the rate of beta cell destruction and actually the rate of diabetes. Besides the fact that it's a conclusion, and many of the people and holistic health doctors believe that statins actually make things worse, taking statin medications. And vaccines have been documented clearly, really, as well. And then there's a chemical exposure, like cigarette smoking, stress, lack of exercise, sleep deprivation. We talked about all that, radiation. All of that creates inflammation in the body, and they do increase your risk of diabetes and disease in general. So getting enough sleep tends to upset the hormonal balance. I talked about radiation, those different drugs, different type of drugs people can take. Psychotic drugs tend to increase the rate of diabetes and also depression on its own. Not basically all of this, it increases the risk. And my point is diet and exercise works better than metformin. So metformin is an anti-diabetic drug. So it drops your blood sugar levels. So, but what we know is that lifestyle intervention will reduce the incidence of diabetes by about 58% versus 31% with metformin. And again, the metformin is not a permanent solution, which your lifestyle becomes more permanent as you go into it and enjoy it, and you feel healthier and more vital. So that's why actually lifestyle gives people better results than taking drugs just for many diseases, including autoimmune diseases we talked about in the other classes. So at any age, you could be healthy and more vital. You just have to do the work and stick to what we teach in the program, stick to plant foods. We're going to talk more about in this class. So what studies have shown is that non-drug approach is a superior to a drug-based approach. And the main thing we see with clients is they just either, don't eat enough, or maybe we had some clients who don't watch any classes at all, and then they completely just forget what they did the program. Some people just do the program for 6 weeks. It just depends on the person. But we know that people who continue implementing, they really pay attention to what we teach in our program, ask questions, reach out for help, they really get the best out of it. So new diabetes prevention research. So those who were instructed when they did different type of research is how to live the lifestyle, what kind of lifestyle changes they had to make, and how they had to improve their diets. they had saw a 50% drop in the risk of diabetes. The curious thing that even if they didn't follow it, they still saw a decrease in diabetes. So the risk of diabetes was reduced by 50% to 60% in the people who were given lifestyle changes. So in the study, only about quarter were able to eat enough fiber, whole plant foods, cut down enough unsaturated fat, dairy, chicken, pork, fish, any type of meat. Like I said, they met the modest goal. They didn't even do it 100%, and they still saw improvements. And people who actually made the lifestyle changes, at least 4 out of 5 of the goal that they were told to do, they had zero diabetes and 100% drop in risk. These are the people who actually followed what they were told to do. And that's exactly they did exactly what was asked of them. So again, lifestyle resets and upgrades the epigenetic program, and lifestyle and diet, which is what we teach in the program here as well. And that's really great news. So it means it's not irreversible, it's not fatal, it's not slow downhill. It's you can reverse it as much, but as they say, by 19 years. So you can live 19 years longer if you do the work it takes. So animal fat is a major factor and it causes insulin resistance. We're going to talk more about that in this presentation. And also animal from outside, but it's also inside the cells. So there's animal fat also inside of our cells. It interferes with the action of insulin. So insulin resistance is connected, not only the cause, it's connected with the accumulation of fat in our muscle cells. But that's part of what insulin resistance is. So there's accumulation of fat in our muscle cells as well. So fat is pretty much what you see, it's what you see in the animal fat, not in plant fat. And in respect to fat-induced insulin insensitivity, because the fat actually, it's an animal fat that actually blocks insulin signaling and the absorption of insulin into the cells. It doesn't seem to happen with plant fat, and we're not sure why, because even if people eat plant fat, and chia seeds are high in fat, and it's mostly omega-3 fatty acids, which seems to actually become part of your cells, part of your nerve cells, brain cells, and creates healthy cells in the body. So even if you eat high-fat diet, but it's high in it's only plant fat, especially chia seeds, you're not gonna get diabetes as you would when you're eating animal fat. So we talked about in our client group, we have different posts about it. It's the animal fat that blocks your insulin receptor. We're gonna talk more about that. So in insulin resistance, which is inability to observe insulin into your cells. So it can actually begin years before getting diabetes. So this begins and years before getting diabetes. And we've seen that children as young as 10 years old start having blood pressure and high cholesterol, plugs in their arteries as young as 10 years old. So it can literally start as much as 10 years before you even diagnosed with diabetes. And that's why if you don't have diabetes, if there's any kind of blood sugar question, we always tell our clients just start implementing what we teach in the program. And of course, you can teach this to your friends and family. So fat toxicity, that's what it is. Diabetes is a disease of fat toxicity. So the pancreas, and really diabetes in general, pancreas, it pumps out more and more insulin, trying to overcome the fat-induced insulin resistance and the muscle in the liver. But again, eventually it gets exhausted. And then there's the silent scream of the liver because the fat builds up in the liver, and the liver too becomes insulin resistance. So basically it accumulates. That's what I talked about. The fat builds up in the liver, and the liver too becomes insulin resistance. And we had clients who had high liver enzymes as well that normalized in a program when they retested the blood work. So type 2 diabetes is a condition of too much sugar, but also too much animal fat inside our organs and inside of our cells. So it's animal fat inside our cells as well. And excess of all these processed sugars, glucose, fructose. And that's not a whole story, because we also have animal protein that goes after it. So animal fat, which attacks your beta cells, like I talked about earlier, it includes fish fat. It also attacks the beta cells of the pancreas, and animal protein that attacks the beta cells of the pancreas as well. So we have saturated fat. We talked about that. Saturated fat is very high in animal foods. When you cook chicken, all the fat comes out. So chicken, they call it lean meat, but it's still very high in fat, saturated fat that destroys beta cells and increases insulin resistance because it blocks insulin signaling. And it also blocks insulin receptors, and it blocks the intracellular signaling and functioning of the insulin. And animal fat, it increases insulin resistance, and it blocks the ability of the group 4 insulin receptors from actually getting to the cell to receive the insulin. And therefore, that's how it creates insulin resistance. So animal fat causes diabetes. That's what I'm explaining here. And like I said earlier, it increases beta cells in the pancreas, and the insulin production starts to fall. And now we have insulin resistance, and you're not able to absorb insulin to have insulin work efficiently, but also the pancreas begins to fail. And like I said, fish is also the worst part. People think, I'm not going to eat red meat, I'm not going to eat chicken, but I'm going to eat fish instead. And I have a whole class just about fish. And it's in the client group. I think we emailed it to you to watch the link. And if you haven't seen the emails, check the junk folder. I don't know if you missed the emails, make sure you follow up, okay? So diabetes is a disease of fat toxicity. So it's diets high in sugar. That's diets high in sugar, high in saturated fat are two of the primary causes. And animal protein. So plant-based diets have lower, plant-based diets also have lower estrogen, and estrogen actually increases it actually increases the rate of diabetes. So high fiber can also lower that. It can also lower your estrogen in the body and your risk of diabetes. And it has more antioxidants, it has anti-inflammatory effect. So less inflammation is going to work against diabetes. So that's important to mention as well. And animal protein is also higher in lysine and methionine. So these are two amino acids, and higher lysine and methionine increases aging, and it disrupts what we call the mTOR pathway, which is the anti-aging pathway. And mTOR pathway, I also studied it in my cancer research because this pathway is significantly disturbed in the cancer cells. People who have cancer, cancer cells really destroy this pathway. So this animal diet is very high in these amino acids, and a vegan diet is best diet to prevent and treat diabetes. And again, I'm not talking about eating vegan processed food, bread. There's a lot of vegans who aren't healthy because they eat junk food all day. I'm talking about what we teach, live food here in the program. Live food, the living food, right? The real whole and processed foods. That's the best treatment for diabetes. And there's a lot of research, other doctors who work with thousands of patients. There's doctors who just specialize in diabetes. They do this work as well. You can find it online. So it's not just us who are doing it, but of course, increase in physical and mental health, and less estrogen from your diet, which is protective against diabetes. Like getting less estrogen. And we're going to talk a little bit more about that. So there was a really good study by Diabetic Watch in 2009, and there were 12 studies together, and there was about 1.25 million people. And they found that type 2 diabetes risk for vegetarians was 35 to 50% lower than that for people eating meat. So people who eat omnivore diet. And again, people can be vegetarian and unhealthy. We have a lot of vegetarians who come to us for help, who eat a lot of dairy products, and they have a lot of vegetarians can have diabetes as well. It just depends exactly what you're eating on the diet. But there's also people, if they tell you they're healthier eating meat, it's because they removed a lot of processed foods and they're eating more vegetables, they're drinking more water, and that's why they're healthy. And then even some vegetarians. But this is a study specifically uh, that showed that. So it just depends exactly what you eat on any diet. But what we teach in the program is the fastest way to reverse disease. So saturated fat, animal fat, trans fat that you see in cooked meat, and animal protein, and you also have free radicals. The free radicals also come from iron. That's important thing too. That's heme iron. It creates oxidative stress. It creates chronic inflammation. And there's also a concept called advanced glycation end products that promotes oxidative stress and inflammation. It's where glucose, it binds to hemoglobin and also with protein, and it causes chronic inflammation. And we talked about ages. It basically formed when you eat animal products, or when you cook your food, you fry your food, or you eat processed foods. You create advanced glycation end products. It just creates inflammation. That's all you need to know. But it just goes into detail about it. So animal protein might not only stimulate insulin growth factor, like we said before, but they also provide high amounts of amino acid, leucine, and methionine, which imbalances the mTOR pathway. So it basically accelerates the aging process, and it also appears that lysine, it burns out the beta cells of the pancreas. So we have to look at the animal protein and how really safe it is. And also there's also a sugar part of it, which is a processed sugar. But interestingly enough, is our clients, even though they eat more fruit, but when they remove animal fat, they're able to eat more fruit without spiking their blood sugar levels. And that's where animal fat actually, like I said, it clogs your insulin receptors. And then clients are able, who have diabetes, are actually able to eat more fruit without increasing their blood sugar levels, because they removed the animal products from their diet that was preventing them from actually reversing diabetes. Well, the question is everyone wants to know is, how much meat can I eat? So that's what people are trying to, understand that. So going back to half century, they found that eating meat 1 or more days a week, it accelerates the rate of diabetes. The more frequently it was eaten, the higher rate of diabetes was. And the plant-based diet had a much lower rate of diabetes compared to eating meat in people of the same weight. So what's the difference between no meat or eating as little as 3% of meat in the diet? So for activating diabetes. And what is 3%? So the research shows that they did this with Buddhist women and men, and those who were vegan and those who were eating a little bit of meat, and the vegan women having only one who actually eating meat. There were some of them were eating meat once a week, had 4 times the rate of diabetes, and men had two meat meals a week had double the rate of diabetes. Just eating 2 meat meals a week had double the rate of diabetes. So the women ate the equivalent about one single serving a week. So that's about 3%. The vegetarian would have quarter of the rate of diabetes compared to only 1 time a week. So even a little bit of meat makes a difference. So the vegetarian women, that's why basically, even if you just eat a little bit of meat, you're still gonna have increased risk of diabetes. That's basically what's saying. So meat causes all types of increased inflammation, rate of aging, chronic disease, and of course, diabetes. So it also increases, when I talk about next, it increases the levels of C-reactive protein, which is the amount of inflammation that you have in the body. It increases your C-reactive protein. Things like infection can increase your inflammation in the body. If you get sick with the flu, like taking vaccines, COVID virus can increase your inflammation as well in the body. So different things can increase your C-reactive protein, but meat definitely increases it as well. And basically, C-reactive protein measures the amount of inflammation that you have in the body. And meat, animal fat, it causes insulin resistance. It raises insulin growth rate factor that's linked to breast and prostate cancer. That's what we talked about in the previous classes, IGF. It increases the risk of breast and prostate cancer. And then meat produces TMAO, which basically promotes heart disease. And I talked about all this in detail in other classes. So if you want to learn more about it in detail in other classes, you can watch those classes where I went into detail about it. So uh, meat increases the amount also of organic pollutants, increases a lot of advanced glycation end products, which overall increases inflammation. We just talked about that. And it also, a lot of people don't talk about, I never heard of it, is that meat may also cause severe allergic reaction through NU5GS. I mentioned it in the previous class, which humans form an antibody against it because meat, it contains NU5GS, and it's a sugar in meat, which humans have antibodies against it. Humans create antibodies against it, which results in inflammation. So we went into detail about this in our previous classes. You can watch more about it. So flash food is high saturated fat flash food, which creates 56% increase in diabetes. Another problem is that flash food is low in fiber, and flash food diets increase insulin resistance. You already know this. And I'm just summarizing it for you, which is insulin resistance, again, ages, increases in baked, processed, grilled, fried meat foods. And basically, anytime you fry anything, it just becomes more toxic to your body. And meat is also higher in estrogen, and it also promotes diabetes and just cancer growth. Just having high amount of estrogen in the body, it just promotes more cancer growth in the body. And fish consumers are at greater risk. Fish eaters, uh, they had a 38% increased risk of diabetes. So, like I said, I used to think fish was the best, but the waters are really polluted these days. The fish fat is particularly toxic to the pancreas, to the beta cells of the pancreas. So, eating fish is not a way of getting out of this. Just if you want to have a little bit of diabetes or a little bit of disease, that's what people do. But actually, sharks, my sister dies with sharks, and sharks are getting cancer these days, and sharks are eating fish. Sharks, all they do is eat fish, and they have cancer. And because a lot of the pollution is in the water, and it's in the muscle of the fish. And of course, there's parasites in the fish. So a lot of the pollution that people getting, and all of these pesticides, they're getting it from eating animal products because it's stored in the muscle cells of the animal and the fat of the animal. So you're going to get far less pesticides if you're eating plants, plus, your cells going to be more healthy to get rid of that. So people who eat two or more, a recent study found that the insulin producing beta cells in the pancreas don't appear to work as well in people who eat two or more servings of fish a week. So just eating more servings of fish a week, and